Hi, my name is Dr.
Gaukhar Baidildinova.
This video is a part of my lectures on evidence-based medicine and epidemiology. I am sure everyone is familiar with the placebo effect, but I am sure you will hear something new anyway. Parallel control with placebo. A placebo is a form of inert substance or intervention designed to mimic drug therapy without specificity for the treatment of a condition. The placebo should have the same appearance and frequency of administration as the active medicine. A placebo control helps to distinguish the results of an intervention, new product, from those due to self-induced effects. This design is used to demonstrate superiority or equivalence. Placebo should only be used if no irreversible harm, death, or irreversible disease occurs due to deferral of available active treatment for the duration of the study, and it is preferred for a short-term study with minimal risk. What idiot called a randomized clinical trial controlled with place and not trick or treatment? The placebo effect is usually more pronounced with psychiatric conditions and helps patients with depression, anxiety, addiction, or even schizophrenia feel better. If you watched a Eurotrip the scene in the coffee shop, I will leave a link to this video. To your knowledge, many psychiatric drugs fail to show their superiority versus placebo, therefore, going for uncontrolled studies. There are some fascinating findings regarding placebo effects. For instance, patients often report that invasive interventions feel more effective than pills. Among invasive treatments, surgery is typically perceived as more effective than injections. Additionally, intravenous injections are seen as more effective than intramuscular ones. When it comes to pills, expensive and highly marketed medications are often believed to have a stronger effect, even when compared to ordinary treatments. The color of a pill can influence its perceived effect. Green and blue pills tend to have a calming effect, while red and orange pills are more stimulating. For pain relief, red pills are often seen as more effective than white or blue ones. This highlights how color perception can impact treatment outcomes. The effect of a placebo is not about the pills themselves, but about patient expectations. Cultural differences shape these perceptions. If a culture associates blue with stimulation, blue pills will act as more effective placebo stimulants than red ones. While context-bound impact is a more precise term, placebo remains the more widely understood concept. Placebo is more than just a pill. It is part of a healing ritual. If a doctor is attentive, caring, and spends more time with a patient, they can achieve better results, showing the power of trust and expectation in healing. There are 5 principles for the placebo control. Unbalanced assignment. Clinical trials usually have fewer people in the placebo group and more in the experimental group to better assess the effects of the treatment being tested. Introductory period. The placebo induction period occurs before the start of a clinical trial, during which all study participants are given a placebo. Although clinical data collected during this phase is rarely useful, it serves several key purposes: screening out ineligible participants, ensuring participants are stable, and assisting with baseline observations. Once the introductory phase is complete, randomization occurs, with participants assigned to different study groups where active treatments are added to the placebo. Early exclusion principle. An important step is to establish negative performance criteria in advance. If participants on placebo meet these criteria, they are removed from the study. This approach helps minimize the impact of ineffective treatments and ensures more accurate results in the trial. Add-on design. In an add-on design, the control group receives both a placebo and the active treatment. This helps researchers isolate the specific effects of the new treatment by ensuring that all participants receive some form of intervention, reducing bias and improving accuracy in measuring its true impact. Double dummy design is used when the drugs being compared are of different nature. For example, comparing a pill to an injection. These were 5 principles and types of placebo control. In contrast to the placebo effect, there is the nocebo effect. This is when a person's initial bias towards an intervention leads to ill health, even though the effect was again neutral. There were videos going around Instagram with parents holding their children in their arms, out of sight of the child hitting the wall and starting to feel sorry for them. Some kids, thinking they had actually hit the wall, would start crying. For example, in Shutter Island, 2010, Leonardo DiCaprio's character Teddy begins experiencing severe headaches and dizziness after being told that the island's water might be drugged. His symptoms appear purely because he believes he is being poisoned, even though there's no proof. When taking beta blockers, patients who were aware of possible erectile dysfunction were twice as likely to report it. Or, currently, many people after listening to psychologists in social networks start feeling victims and having traumas. Nocebo. Mass psychiatric epidemics in the 20th and 21st centuries. Mass psychiatric epidemics are often linked to imagined poisoning, exposure to non-existent toxins, infections, or radiation. Common symptoms include headaches, dizziness, nausea, and abdominal pain. For example, concerns about cell phones causing headaches were not confirmed in placebo-controlled studies. Such fears are often triggered by widely discussed events in the media. In 2001, over 2,300 people in the U.S. sought medical help, believing they were exposed to anthrax after terrorist attacks. Similarly, after the Aum Shinrikyo sect released poison gas in the Tokyo subway, panic led to outbreaks of psychotic symptoms triggered by strange odors in public places. These cases highlight the powerful role of fear and expectation in shaping real, physical reactions. Placebo, and for a lesser extent, nocebo, are the most famous psychiatric effects that can lead to differences in clinical trials, but not the only ones. For example, there is the Hawthorne effect, when people behave differently, when they know they're being watched. Or white coat hypertension, when patients' blood pressure changes due to the presence of a physician or other healthcare provider. These and other effects are described in more detail in my paid course on Udemy called Critical Assessment of Clinical Articles, where I explain how to read and critically evaluate clinical studies. It's a very great course, the same as my second course, Scientific Writing, where I tell all the nuances of how to write a scientific article or dissertation. Links are in the description box.